Dr. Mehmet Oz, the administrator for the Centers for Medicare and Medicaid Services, he is out there and he is rooting out fraud that's happening nationwide, folks. Here he is at his latest stop, California, exposing the expensive and deadly side of hospice fraud in Los Angeles.
They're called SixPacks because you can put 6 residents in the home. If they're seniors and you sort of treat them like they're hostages, you don't give them much, you can make a lot of money off them. Deplorable conditions, folks who are malnourished, being served moldy food, not getting the care you would want if you were living anywhere. These other hospice centers charge $6,000 a month per person. That's $36,000 a month that could be made in this house. There's a lot more than rent, which, by the way, they might have been charging Medicaid as well.
Wow. Pleased to bring in Dr. Mehmet Oz with more on what he is finding. Dr. Oz, a pleasure to have you today. California waiting to hear what Gavin Newsom is going to do to fix all this on a laundry list that he needs to address. But talk to us about the scams that are happening there, how it could be deadly, and what action right now CMS is rolling out to protect some of the vulnerable seniors. This could be our parents, our grandparents.
Well, let's start off by saying if you want to make health care more affordable in America, deal with the fraud and the waste and the abuse, which we believe takes more than $100 billion out of Medicare and Medicaid every year. To put that in perspective, if you're worried about Medicare being around for you, taking care of the fraud would double the life expectancy of the Medicare Trust Fund. So it's a big deal. What's happening in California is emblematic of what's happening in other states, but it's especially painful when you love these programs, as I do. Medicaid, Medicare, they're these beautiful gems of social network program that we have that supports our seniors and our frail. But what I witnessed in California is something that I don't think anybody in the country could have imagined. 1/3 of all hospices in the entire country are in Los Angeles. Think about this. I mean, how much death is there in Los Angeles? 1/3 of all the hospices designed for people at the end of their life are in LA County. Now, what I've learned is since you corrupted that system and built so many fraudulent centers, which clearly aren't providing high-quality services. In fact, most people seem to survive the 6-month period you're supposed to be in hospice in California. It has better actuarial survival than you and I do right now to be in one of these hospices. They're definitely not picking patients who are at risk. It creates an ecosystem where other fraudsters get involved. So what I just showed in that video that you were kind enough to display is the reality that people who own homes can now take these seniors, kidnap them, traffic their Medicare information, and get hospices to pretend that they're taking care of them. Again, the people in the hospice have no idea this is happening. The people in these homes are completely off to the side.
It's frightening. It's frightening. And Dr. Oz, this is vulnerable, elderly people. And then on the other side, we saw what is happening when people are scamming daycares. YouTuber, independent journalist Nick Shirley kind of broke that story. But then you have that to tackle as well. So when you talk about how you want to make healthcare more affordable, it starts with the fraud. It's a huge, huge task and a problem. Is any Democrat interested in working with you to find this out?
Oh, there are Democrats who are interested. I've talked to Governor Josh Green, for example, who's a doctor. He's in Hawaii. He actually was in the public health service. He witnessed fraud firsthand. He wants it to stop. If this becomes a partisan issue, we're going to hurt everybody. If this becomes focused on dealing with the actual fraud, and for those accusations that this is just a blue state issue, there's some problems in blue states, but we sent a letter to Florida earlier this week. Maine, I would say, is a purple state. They've gotten a letter from us. But yeah, California is varsity team when it comes to fraud, waste, and abuse, but they've got a close competitor in New York State, and both of them, of course, are witnessing what happened in Minnesota. So there's some bad practices, and then there's some better practices. Every governor should want to deal with these problems. Medicaid, of course, was run by states. It's a governor concern in particular. I've got to watch both Medicaid and Medicare. And the things we're going to do about this, which you asked about earlier, is a complete revamping and how we move to stop paying the money. Here's the big challenge. I want people to go to jail. I'm sure every one of our viewers can't wait for that to happen. But even more importantly, I don't want the money leaving our building. We are responsible for $1.8 trillion. If the perp walk takes us, months or maybe years to create by doing all the investigations, in the meantime, they're stealing money.
The grift
Let's
continues.
stop the money from leaving the building.
The grift continues. I'm really glad you are putting a light on this, and I'm really happy that some are willing to, even in the Democrat states, address it. We didn't really hear too much from Governor Walz or Keith Ellison for years with the daycare stuff. Dr. Oz, I hope you come back and keep us updated. Really good to have you today, sir.
God bless.